Assalamualaikum and hello everyone. Dr. Hamzah speak in this video. Okay, in this video I would like to deliver my lecture entitled Chemical Hazard for the course FSG 301 under the chapter number 3. Okay, without further ado, I would like to deliver my lecture right now. For a second slide, we want to talk about chemical hazards. So what do you mean by chemical hazards? Based on this slide, chemical hazard is any substance that can cause a health problem or risk and danger. Example hazardous chemicals include industrial chemical, pesticide, agriculture chemical, pharmaceutical, cosmetic and food related chemical that may be present in the workplace and that have an adverse effect on worker health as a result of direct contact with or exposure to that respective chemical. Next slide entitled Identifying Chemical Hazards. So how we want to identify certain that chemical compounds or that chemical material is hazardous to humans or not. Three approaches that we can apply. The first one, chemical label on the chemical commercial product. The second one, we can obtain the information in safety data sheet, and the last one, we also can obtain the information related about the respective chemical compound or chemical material derived from hazardous chemical databases. Next slide on chemical label. For chemical label, the manufacturer or importer is responsible for ensuring that any chemical or chemical product is classified and labeled according to the current regulatory requirement. The component for chemical labeling are signal words, hazard statement, precautionary statement, and pictograms. Then, for this slide, we want to discuss about safety data sheets. A safety data sheet, or in a short form as SDS, previously known as Material Safety Data Sheet, or in short form that we call MSDS, is a document that provides information on property or hazardous chemical and how they affect health and safety in workplace. For example, it includes information on the identity, health and psychochemical hazard, safe handling and storage, emergency procedure, and disposal consideration. The manufacturer or importer is required by legislation to prepare an SDS where the substance, mixture, or article is classified as a hazardous chemical. Next slide on elimination of chemical hazard. Okay. This is a few examples of the method or approach that we can use to eliminate the chemical hazard. The first one, A. Substitution of the less hazardous chemical for chemical hazardous to the health. B. Total inclusion of the process handling system. C. Acceleration of the work to control the emission of chemical hazardous to the health. D. Modification of process parameter. E. Application of engineering control equipment. Or we can use other approach, which is adaptation of safe work system and practices that eliminate or minimize the risk to the health. Or the last choice as provision of the approved personal protective equipment. Next slide about another hazard that we can develop during our work in our workplace. So this kind of hazard that we call ergonomic hazards. Further hazard is ergonomic hazards. So what do you mean by ergonomic hazard? So this kind of hazard is the physical factor within the environment that harm the musculoskeletal system. Ergonomic hazards include terms such as repetitive movement, manual handling, workplace job or task or design, uncomfortable workstation height or poor body positioning. Next slide, in this slide, about understand ergonomic injuries. So in this slide, I want to share with you some example of the ergonomic hazard or injury. For example, like disorder of the muscle, nerve, tendon, ligament, joint, cartilage, blood vessel, or spinal disc injury. This slide entitled Workplace Contributing the Factor. Workplace contributing factor for the ergonomic hazard or ergonomic injury. There are three ergonomic risk factors that cause ergonomic injury, which are the first one, work posture. The second one, high force or forceful exertion. And the third factor, which is high or low frequency or repetitive motion, sorry. In combination between these three factors that could also enhance development for this kind of injury that we call ergonomic hazard or ergonomic injury. Next, we want to discuss about posture factor. In natural posture, the joint can absorb force more easily than in others. Outward and extreme posture increase susceptibility to the injury as they may stress joint component and reduce blood flow. Next, about the outward posture factor. Outward posture typically include repeated or prolonged reaching, twisting, bending, walking, overhead, kneeling, squatting, and holding fixed position or pinch grips. They may affect the various areas of the body such as the hand, wrist, arm, shoulder, neck, back, and knee. It may be caused by using poorly designed or arranged workstation, tool and equipment, and poor work practices. Then, in this slide, we want to discuss about force factor that could cause for development of ergonomic injury. So, force factor. So, force is the amount of muscular effort expended to perform work. Gripping, pinching, pushing, pulling, and lifting object place additional force on the body joint structure. Increasing this forces require additional muscle exertion and places greater loads on joint and connective tissue. Prolonged repeated exertion for this type can cause fatigue and may contribute to the musculoskeletal problem when there is inadequate time for the rest or recovery. Next slide, we want to discuss about frequency factor or repetitive motion. The factor that could cause hazard injury is called frequency or repetitive motion. So we want to discuss about the ergonomic hazard injury because of this factor that we call frequency or repetitive motion. It is repetitive work that same type of the motion are performed over and over again using the same muscle, tendon, and joint. Next, how we want to improve ergonomic improvement or improving workplace to reduce the ergonomic injury or ergonomic hazards. Ergonomic improvement are changes made to improve the fits between a job and the capability of the employee for performing it. They are commonly grouped into three categories. The first one, engineering improvement. The second one, administrative improvement. And lastly, safety gear use. Now, the first ergonomic improvement that we call engineering improvement. Engineering improvement include rearranging, modifying, redesigning, or replace tool, equipment, workstation, packaging, part or products. The improvement can be very effective because they may reduce or eliminate the underlying reason for contributing the factor. Next, info related about improvement option for the workstation. There are four elements should be the factor in improving workstation, which are eyes to source, hand to inputs, device body to the chair, and feet to the floor. Now we want to discuss about improvement option for the tool. Good design and proper maintenance can help reduce pressure point on the hand. Such tools are handle, trigger, and fixtures. Next, improvement that we call administrative improvement option for ergonomic hazards. The first option for the improvement is providing variety in the job. The second one, adjusting work schedule and workplace. The third, providing recovery time. The fourth, modifying work practice. Another improvement or options that we call ensuring regular housekeeping and maintenance of the workspace to equipment. And the last option is encouraging exercise. Last factor we want to discuss to improve ergonomic improvement option or factor we call safety gear use. So what do we mean by safety gear use? For safety gear use or personal protective equipment include glove, knee, elbow pads, footwear, and other items that employee wear. Those tools can also be used as option to protect employee in workstation. Next, we want to discuss another hazard that can be developed in workplaces that we call psychosocial hazard. Okay. The last classification we want to discuss in this chapter number 3 is called psychosocial hazards. The hazard arises from organization or personal factor, with the major factor being poor design on the work and job, poor communication and interpersonal relationship, bullying, occupational violence, and fatigue. Next, we want to discuss what the factor that contribute for the psychosocial hazard. The first factor that contribute for this problem is alcohol in the workplace. The second one, body stressing, bullying in the workplace. The fourth factor, customer aggression, and the fifth, uh, driving fatigue. The sixth factor that contribute for the social hazard that we call remote or sedated work, and lastly, work-related mental stress. Now we want to talk one by one the factors that contribute for development of the psychosocial hazards. The first one is alcohol in the workplace. These hazards can be happen especially in the workplace that accepting alcohol use. In this series, risk or alcohol use in the workplace are adverse mental impact. That's the negative impact for the employee that consume or drink alcohol. Possible violence from employee and so on. That's another example. Example for the negative impact for the consumption of alcohol in the workplace. And based on this slide, we can read or found another example of negative impact due to alcohol consumption in workplace. This slide shown another example of negative impact due to alcohol consumption in workplace. So, for example, like risk to organization includes workplace accident that could result injury or death, asceticism resulting from excessive alcohol consumption, lost productivity from presentism, due to the effect alcohol, reduce moral among worker, negative impact on other worker who have to cover for absent or intoxicated worker. Remedy for the alcohol problem for the employee in workplace. So what is the example of the troubleshoot that we can apply to overcome the problem of alcohol use in the workplace. For example, like recognizing the workplace and external factor that influence the use of alcohol in the workplace. The second approach how to overcome this problem, which is for the alcohol use or consumption in workplace. The second method, which is use preventive intervention to promote safe work practices around alcohol use, direct resources toward a protective rather than reactive solution. The fourth approach, develop and implement a comprehensive alcohol and other drug policy in consultation with worker. Next, provide training and support for management staff to develop skill to manage alcohol-related issue in the workplace. Later on, we can use another approach, which is raise awareness of the risks associated with alcohol use in workplace and provide training to all staff. And last approach that we can use to overcome this problem is conduct a risk assessment to identify factors that may promote alcohol use in the workplace. For example, storage of alcohol in the workplace and alcohol being used to reward worker. Next, we want to discuss about body stressings. Next factor that could cause psychosocial hazard is called as body stressing, which associated with repetitive and strenuous work. Impact this hazard the employee are imbalanced, inhibiting our response and injury. Okay, this slide about typical body stressing injury. So typical body stressing injury include sprain and strain of the muscle, ligament and tendon, back injury, joint and bone injury or degeneration, nerve injury or compression, muscular and vascular disorder from abrasion. Next, proceed for the soft tissue hernias, and lastly, chronic pain. This slide entitled Workplace Bullying Behavior. Bullying in the workplace. Workplace bullying behavior such as abusive, insulting or offensive language or comment. The second one, characteristic for the bullying behavior, aggressive and intimidating conduct. And the third characteristic for the bullying behavior, practical joke or initiation. The fourth, unjustified criticism or complaint. And the last one, setting tasks that are unreasonable belong or beyond a person's skill level. Now we want to discuss about risk of bullying. Risk of bullying example, how worker mental health with depression, psychological distress and emotion exhaustion. Are they negative impact, stress, anxiety, and so on. For example, like sleep disturbance, mental health issues such as depression, reduced quality of the family and home life, increased absenteeism and staff turnover, and lastly, reduced work performance. That's the risk due to bullying in workplace. Okay, this slide entitled Customer Aggression. Customer aggression can be defined as unacceptable hostile behavior exhibited by a current or former customer of an organization toward an employee that create an intimidating, frightening, or offensive situation. That meaning for the customer aggression. Risk customer aggression. Risk of customer aggression are recruitment costs when high turnover occur, training of new staff when there is increased turnover, salary costs when employees are absent from work, downtime for supervisor and manager in addressing underperformance and absenteeism. For example, cost of the lost time for the supervisor and reduced staff, and client satisfaction which impact on moral, productivity and attendance. Remedy for this problem, which is for the customer aggression. The first approach, identify any traits relating to the customer aggression. The second one, evaluate these traits in consideration of the workplace profile, set an acceptable level for the risks related to the workplace, and the last approach that we can use to overcome customer aggression problem, implement strategy to reduce the level of risk while monitoring for any changes in the trait or breakdown in mitigating strategy. The next factor we want to discuss about driven factor. So the fifth factor for the psychosocial hazard is driven factor. Fatigue is described as A, feeling sleepy, or B, feeling physically or mentally tired, or C, feeling exhausted or lacking energy, and so on. Impact the problem to employee cannot function within normal boundary. Rinse driver fatigue. Rinse driver fatigue due to effect of the rinse due to effect of the fatigues. For example, like difficulty in concentration and be easily distracted, poor judgment and decision making, reduced capacity for effective interpersonal communication, reduced hand-eye coordination and visual perception, reduced vigilance, slower reaction time, and reduced memory. Next, we want to discuss about remote or isolated work. So what do you mean by isolated work? Isolated work may involve work activity undertaken in a selected area on or off site, either during or outside normal working hours. Then, what do we mean by remote work, which may involve work activity undertaken at a location removed from an oppressive environment where there are few people and where communication and travel are difficult. This may include land or the sea activities within Australia or overseas. Now we want to discuss about RINs. RINs belong to remote or isolated work area. What happened to the employee that working in remote or isolated work area? Characteristic of RINs remote or isolated work area example. A major danger for remote or isolated worker is sustaining an injury that precludes self-rescue, risks that can be encountered, work environment, remote premises, remote communication system and procedure, physical and psychological fitness for duty, vehicle and travel, information training or supervisions, and lastly, emergency plan. Next, to find the approach or method how to overcome the problem work in remote or isolated area. The first one, relocating the work, provide vehicle, equipment, tool, and communication equipment suitable for the use in the terrains. Two workers teams, ensuring workers are physically and mentally fit to perform the work. Appropriate training in provided about working in remote or isolated environment, avoiding riskier time of the day, ensuring adequate facility for work, including toilet, drinking water, eating facility, personal storage, providing accommodation, have a check in the process whereby workers are required to contact the home base at nominated time, have an emergency response plan when workers fail to report in at allocated times. Next factor, we want to discuss about work-related mental stress. The last example of psychosocial hazard is work-related mental stress. Work-related mental stress has been described as the adverse reaction experienced by worker when workplace demand and responsibility are greater than worker can comfortably manage or beyond the worker capability. Risks belong to work-related stress. The risks that derive from this hazard are high level of job demand and low level of job resources increase the risk of mental stress. And the second risk belong to work-related stress is mental stress causes the body to move into a fight or flight reaction which releases adrenaline and cortisol, raises the heart rates, boosts glucose level in the bloodstream and divert energy from the immune system to other area of the body. Remedy to overcome the problem of work-related mental stress. The remedies for work-related mental stress are identify the area within the workplace that are likely to cause stress, assess the risks to determine which require control the risks by eliminating or minimize where possible, and lastly, review the control and their effectiveness. That's all my presentation for this chapter number 3. Thank you so much.